The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
For millions of burn victims, there is new hope for a less painful and more effective recovery. Soybeans are showing new promise in reducing bone loss in postmenopausal women. For many, choosing an assisted living facility is no longer something to fear. An online health service can now help you deal with work-related stress. New advances in liposuction are making this surgery easier and more effective. A breakthrough procedure is allowing patients to get dental implants in only 24 hours. All this and more on Today's Health. Today's program is sponsored in part by the LifeCell Corporation, the Indiana Soybean Board, Harborside Healthcare, OneBody.com, Microair Surgical Instruments, and the Florida Institute for Periodontics and Dental Implants.
A clean bill of health. Did you know that phrase goes back to the 19th century when bills of health were issued to ship's captains certifying there was no disease on board? Hello, I'm Robert Urich, and welcome to Today's Health. When it comes to health issues, injuries due to accidents are a major concern. In the United States, approximately 2.4 million burn injuries are reported each year. Fortunately, there are healing remedies that can help alleviate the pain and promote recovery from burns.
Everyone is at risk for a burn accident, but the people at greatest risk are children under 5 years old who often get scalded, and men between the ages of 17 and 30 who are susceptible to work-related accidents, and many related to alcohol. Every year there are more than 2.5 million burn injuries in the United States. About 50,000 of these require hospitalization, and about 5,000 of them are fatal. A burn injury is a complex trauma that often damages the epidermis, or outer layer of the skin, and the underlying dermis.
The epidermis is the part of the skin that we see and the part that we feel when we touch each other. And the dermis is the part that gives the skin its component, its structure. It has the sweat glands, the hair follicles, and the oil glands in it. In a full-thickness burn, the skin itself loses all of its structural components. It has no ability to heal. It loses its elastic power. It loses all the functions that skin does. With a full-thickness burn, the way we heal those is we actually cut the burn off down to viable or alive tissue, and then we take skin from somewhere else on that patient's body and put it back on the site where we took the burn off, and that's called skin grafting. The obvious disadvantage of skin grafting is that you now have another wound, and that wound can carry all the problems of healing that the initial burn had itself.
Burn surgeons have an option to help minimize the additional wounds created to complete skin grafts. By using Alloderm, developed by LifeCell, surgeons need to take only a very thin layer of the patient's epidermis to create the skin graft, no matter how large or how deep the wound goes. The Alloderm provides the dermis, or the underlayer of the skin graft. It is cryogenically processed from donated human tissue.
Alloderm provides a framework for the patient's own cells to use as a skeleton to migrate across and build a new skin. The benefit is the donor site heals much quicker and scars much less and has more normal color. And the benefit to the recipient site is you have less scar contracture, so you don't have so much of the deformities of the burn, and also it gives a better pliability to the skin than a normal skin graft. With Alloderm, we get better functional outcome. That means that we return more to the normal function of skin, and we also get better appearance.
The scars from a burn can be damage enough for one body to cope with. Having another wound to complete a skin graft can create even more trauma. Fortunately, advances in skin grafting may help heal one severe wound without creating another.
New research into soybeans is showing promise in the fight against bone loss, and what you should know about choosing a nursing home. Coming up on Today's Health.
The keys to healthy living are not a mystery. Proper diet and exercise can help us feel better, avoid disease, and live longer. Unfortunately, with our busy lifestyles, the two things that get shortchanged are often our diet and exercise. Maybe it's time we rethink our priorities. Now let's take a look at this health topic.
Exercise and proper nutrition are integral parts of a healthy lifestyle, but it is also important to educate ourselves about ways to prevent or lower our risk of disease.
One way to do that is to include more soy in our diet. Soy protein derived from the soybean is associated with a variety of health benefits. Most recently, it was recognized by the Food and Drug Administration as a nutrient that may help reduce the risk of heart disease.
Research in the field of soy is ongoing. Indiana soybean farmers, for example, invest a percentage of their bean sales in research of soybean production technologies, new uses, and promotion of soy-based products. One of the most important soy research partnerships is that of the Indiana Soybean Board and Purdue University.
The Indiana Soybean Board has several program areas, including research. And we've worked quite a bit with Purdue University in sponsoring soy food research for human consumption.
Purdue University conducts valuable research through its Botanical Center, which studies the health effects of plant extracts sold as dietary supplements.
We studied 15 postmenopausal women on 3 different diets. We found that if the women were on the soy protein diet as compared to the animal protein diet, it amounted to a savings of the skeleton if you projected it on a whole year of 1.3%. Well, that's the average bone loss a woman undergoes in menopausal years. So it would seem if you substituted part of your animal protein in your diet with soy protein, you could completely prevent the skeletal loss that most women undergo.
Research and development of new soy products goes beyond the work of scientists at the Botanical Center. For example, the Indiana Soybean Board sponsors an annual student competition that helps develop tomorrow's scientists.
As a result of some of the student research, we've got products that are now available in the marketplace. One of them would be the soy candle, which is cleaner burning, does not have soot as a paraffin base does. The crayon, which has a brighter color, which has a more brilliant color than the standard crayon. But most of this stuff is very environmentally friendly, and I think as farmers we have a responsibility to ourselves as well as the environment. We're very conscious of that.
Consumer products like soybean oil candles have numerous health benefits. They burn longer, cleaner, and cooler with less soot and have safe, lead-free wicks, so you can breathe easier.
The Indiana Soybean Board is leading the way in cutting-edge scientific research and development of new soy products. And that means more opportunities for better health and healthier living for all of us.
Someone very wise once said that it's not how long you live that counts. It's how well you live during the years you have. If we can take charge of our health and maintain it, we may be able to live better and longer. There are many good ideas to help us stay healthier. Here's one now.
"50 years ago, life expectancy in this country was 66 years of age. Today, that figure has increased substantially. With healthcare advances, people are living longer and more Americans will need some form of long-term care placement. Every day, aging seniors and their adult children face the difficult decisions associated with long-term care placement. By getting to know the options available, you can take the critical first step in the decision-making process. 1 in 5 Americans over age 50 is at risk of needing long-term care in the next 12 months, and studies suggest that nearly 3 out of every 5 people age 65 and over may need some kind of long-term care in their lifetimes. But too often we don't take the time to plan for this part of our lives. That's where a reliable nursing and long-term care provider like Harborside Healthcare can help you explore the options.
I think when choosing a long-term care facility, an individual should spend a significant amount of time looking into and doing some research on that particular nursing home or a number of nursing homes.
An experienced and respected long-term care provider can help you identify and prioritize your medical, social, emotional, and geographic needs. They can also help you determine the level and type of care you're looking for, whether it's Alzheimer's care or a skilled nursing facility, and then help you find a solution that fits your budget. All you need to do is call and schedule a visit.
We strongly encourage individuals who are considering placing an individual in a long-term care center to visit all centers. Particularly, we want them to come visit our center. We're very proud of the services that we offer. We're very proud of the management teams that operate our center, the nurses that provide care, and the therapists that provide those services as well. We want people to come in, meet those individuals. We want them to ask the questions that they have and to make sure that they're getting what they need for their loved one.
Skilled nursing and long-term care management companies such as Harborside Healthcare help facilities offer a caring, safe, supportive environment for extended care residents. Providing management services to facilities offering high-quality, cost-effective nursing and rehabilitation services, they serve 50 facilities in 9 states. If you wish to learn more about skilled nursing and long-term care services, log on to www.harborsidehealthcare.com. You or a loved one may spend as many years in a long-term care facility as you do in your current home. Take the time to make sure it fits your needs, just like home.
When we come back, how the internet is helping people deal with workplace stress, plus a more effective procedure for liposuction. This and more on Today's Health.
It's hard to enjoy a high quality of life when stress is gnawing away at you. The remedy, though, can be very, very simple. Try to do something you like every day. Play with your dog, listen to soothing music, or watch a funny movie. It could make you happy, healthier, and help you live better.
Stress. While there are many factors that contribute to stress, more and more work-related issues are a major source of tension and anxiety. Studies have shown stress can reduce a worker's effectiveness and increase the risk for illness, back problems, accidents, and lost time, directly impacting the company's bottom line.
Stress has become so prevalent in the workplace it is now considered an occupational issue, and many companies are looking for new ways to deal with the problem.
In light of recent studies showing a relationship between stress and illness, the National Institute of Occupational Safety and Health, or NIOSH, reports at least 1/4 of today's workers feel overwhelming stress at work.
People often run into stress, and from many different factors. It can be the fact that there's layoffs going on in their job life. It can be they don't know what to do with the rest of their lives, what their meaning is. They can have the health of a loved one become a very stressful situation, or it can be that they just don't have time today, which is a big issue for most people.
Now OneBody, an innovative company with expertise in alternative and complementary medicine, has developed the OneBody service, designed to help employees feel better, reduce stress, and find balance in their personal and professional lives. With its holistic approach, the OneBody service increases a company's ability to recruit and retain its best and brightest in the current market climate.
The OneBody Balanced Life Service is a multi-tiered program, a structured lifestyle program that's designed to help you feel better, to reduce your stress, and to find your own balance. It is a 3-part program that involves a live coach to help you be personally supported through the program. The second piece is what we call the practices, which is an order in which you start to do small actions on a daily basis to help you start to find your balance in your life. And then the third piece is something that we've been working on for 5 years, which is we have 60,000 practitioners across the country as part of our network, from acupuncture to yoga to doctors, medical doctors who understand that when you have cancer, you do things more than just chemotherapy. You do nutrition, you do mind-body balancing things.
In one study, a company that set up a 2-year stress management educational program, the savings to the company in workman's compensation was $150,000.
If you wish to learn more about reducing stress in the workplace, log on to www.onebody.com. Helping your employees learn new skills for balancing their lives and coping with stress can create greater employee loyalty as well as contribute to the bottom line.
As more and more people turn to cosmetic surgery as an option to enhance their appearance, It's important to know how to find the right doctor and choose the right procedure. Here's the latest on looking your best.
As more people consider liposuction to enhance their appearance, it becomes important for surgeons to have state-of-the-art technologies that allow them to perform this procedure safely and efficiently. Liposuction is a procedure where a blunt instrument called the cannula is inserted beneath the surface of the skin and acts as a suction device to remove fat cells from the body. Until recently, there were two types of procedures surgeons could use to perform liposuction: conventional liposuction, or SAL, and ultrasound-assisted liposuction, UAL.
In traditional liposuction, the surgeon actually has to manually move the cannula back and forth to remove the fat. Ultrasound-assisted liposuction is a method where the surgeon can remove the fat with a cannula that moves. At the end of the cannula, there's energy, there's actually heat that allows to remove the fat. The downside to it, that energy can cause sometimes burns, fluid collection, and some scarring underneath.
Now there is a new FDA-approved procedure that offers physicians the ease of ultrasound with less cost and fewer risks. This new technology, called power-assisted liposuction, developed by Micro-Air Surgical Instruments, works by using a reciprocating cannula that makes the operation easier to perform. Power-assisted liposuction works with either a pneumatic or electrical device that causes the cannula to move back and forth a fraction of an inch at a rate of 2,000 to 4,000 cycles per minute, allowing the cannula to move through and break up fat tissue with relative ease. This is especially useful when working on fibrous or scarred tissue because this type of tissue is very difficult to break up.
The power-assisted lipectomy is a especially useful technique in areas where there is a lot of fibrous tissue that is difficult to remove, and one gets a more accurate and a better result for the patient.
Power-assisted liposuction requires a smaller incision and does not use heat, causing minimal scarring and no risk for burns. With power-assisted liposuction, there is no special training or learning curve for the surgeon, and since this procedure is easier to perform than conventional liposuction, there is less likelihood that the surgeon will suffer from fatigue or reduced stamina. As new advances in surgery yield significant benefits for both patients and doctors, it's important to stay informed. If you are considering liposuction, talk to your doctor about all the choices available. Power-assisted liposuction may be the option that is best suited for you.
We could spend hours on every issue we discuss on this show, but unfortunately, we only have 30 short minutes. That's why it's important for you to visit our website at vstar.com. We have facts, data, hyperlinks, and video about every topic we explore. Staying healthy is important to all of us, and new discoveries in the fields of science and medicine are giving us more options when it comes to our health. In our next story, we'll look at a new solution to an old problem.
According to Consumer Reports, about 19 million American adults have no teeth, and another 113 million are missing at least one tooth. And while typically many of those gaps are filled with dentures and bridges, there are limitations to those solutions.
With the evolution of dental implants, permanent tooth replacement has reached a new level of sophistication, comfort, and quality. Now the next generation of permanent tooth replacement is revolutionizing that process.
Dental implants are small titanium anchors shaped like tooth roots that support permanent tooth replacements. Traditionally, doctors allow 3 to 6 months for implants to bond with the jawbone before they can create new teeth and attach them. A lengthy process that requires many dental visits. It can be difficult, emotionally draining, and physically uncomfortable for patients. Utilizing a scientifically established method for permanent tooth replacement, a team of doctors at the Florida Institute for Periodontics and Dental Implants is using a procedure known as Teeth Today Immediately Loaded Dental Implant Restoration. This procedure replaces failing teeth or a full lower denture with permanently attached teeth in 24 hours.
This procedure can erase dental problems virtually overnight. We can overcome decay problems, root canal problems, bone loss from periodontal disease, poorly fitting dentures, and do it almost instantly. Over the last 5 years, we've placed hundreds of implants this way with very high success rate. In fact, 100% of the patients we've treated this way now have permanent teeth.
They kept saying to me they're going to pull the bottom teeth and put the implants right in, and then they're going to put the temporary caps in, and I was amazed. I didn't see how it could be done, but they said it could, and it could.
A leader in the use of the immediate load implant procedure, Dr. Jeffrey Gannalis and his partners are bringing this technique into mainstream dentistry. Their work is based on scientific data that demonstrates how implants can support an equally distributed biting force immediately after they have been put into the mouth. The complete arch configuration of replacement teeth creates a predictable balance anchored on the implants, allowing patients to immediately enjoy the comfort, benefits, and beauty of new permanent teeth. For more information, visit their website at www.perio-implant.com.
Teeth Today immediately loaded dental implant restorations. It's a dental procedure that makes a real impact on health and the quality of life.
Armed with the right attitude and proper knowledge, we can face almost any challenge with courage and success. And today we've gathered new insights on several important health issues that can impact our everyday lives. If you have any questions on any of the topics we've discussed on today's show, log on to vstar.com and we'll link you right to the source. I'm Robert Urich, inviting you to join us next time as we explore the issues that affect your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.